I like Poland very much. Actually, I started lecturing in Poland back in 2003, so a long time ago. And I told you before, it's a country that's evolving, and I saw the evolution, and I'm impressed by the progresses that have been made. The level of dentistry in Poland is very good, and I think they are willing to improve. What I mean is, I always see full crowds like today. They are eager to learn something, and I also think they are quite smart. They can select exactly what they need to improve. So, as I said, quite impressed and positively impressed. Actually, Chris contacted me a long time ago, I have to say, and I immediately said yes, because it was quite a challenge for me. I am known in Poland for resin composites. I lecture here for 10 years about resin composites and fiber post restoration. And it was nice for me to have this new challenge. And Chris was quite tricky, because first of all he put me in, and I said yes, of course. It was nice. His invitation was nice. And then he asked me, can you treat endo versus implant, which was a completely new topic for me. Today was a premiere. I was quite nervous about that. But I worked quite hard for this lecture, and I'm really satisfied with the outcome, because I realized that actually, when Chris asked me about this lecture, I thought, endo versus implant, am I going to talk about philosophy or about something up in the air? But then I realized that endo versus implant is everyday dentistry. Every day we're challenged with the question, should I keep this particular tooth, or should I pull it out and stick an implant? The main criteria to me is I treat teeth that are restorable. I don't agree with endodontists trying to treat teeth that don't have enough bone around the tooth, or have very deep caries, very deep margins, or big perforations. Of course, generally speaking, in general, I think that you should try to save teeth which can be restored. Of course, it is different if it is a central incisor or a second molar. It is different if the operator is experienced or not. But the non-experienced operator should be so smart to refer that patient to a more experienced operator. And finally, it is different if it's 15 years old or 90 years old. So, as I said during the lecture, so you have to select so case selection is the name of the game. If you can't select your case, you'll be a, let's say, satisfied dentist, because your failures will be less. I have less failures than I have before, because actually I don't do treatments that I know are hopeless, on teeth that are hopeless. There are situations where implants are a better solution, and I honestly suggest my patients to do implants. But as I showed during the lecture, it all depends on how you give them the information. If you tell them that the tooth can be restored with a certain amount of, with a good percentage of success, without doing an implant, and that it is more cost effective, they will not need surgery, and they will have their own tooth. They will have time to do an implant. So I think they will go for the endo. I think that the best dentistry you can do is the least invasive dentistry. So you have to use minimal invasive dentistry. I tell my patients, if I were you, in my mouth I would do this. The rule that I gave to the audience today was the daughter rule. Treat your patients as if they were your daughter. So think about, what would I do if that particular tooth was the tooth of my daughter? And I think if you work ethically like this, you will have good results.